Hi, I'm Joan Daniels. I'm the Senior Director of Hooved Animals here at Brookfield Zoo. My role here with the giraffes and the other hooved animals is to take care of all of their needs. I work with the veterinary staff, I work with zoo nutrition, and a lot of other people to develop care plans. And part of that is making sure that we continue to work on reproduction, because many of the species that I work with are endangered species, so they're here for breeding. And we work together with a lot of experts to put animals together and pair them up properly. The Association of Zoos and Aquariums have some really wonderful programs that help us manage our animals throughout zoos in North America. And one of those is the species survival plans. And those are plans that are put together with the help of expert animal care staff that know the species really well. And then also we work with geneticists to take a look at the population that is within the North American zoos. It's like a mating system just to try to pair up the best genetic matches so that we have continued healthy populations. So a lot of times we'll put animals together specifically because they are genetically compatible with one another. We have reticulated giraffes here at Brookfield Zoo, but all giraffe species are part of the SAFE program for AZA, Saving Animals from Extinction programs. And we work on developing good conservation practices, supporting our partners in the wild that are doing all kinds of good conservation science, and then also developing good programs and good communication about the plight of the animals. So unfortunately, there's been kind of a silent extinction going on with giraffes in Africa. The reticulated giraffe here at Brookfield Zoo is one of the ones that is now considered an endangered species, something that we didn't expect to see with giraffe populations, but it kind of snuck up on conservationists. The reticulated giraffe population, for example, has dropped 30% in just the last 10 or 15 years, so it's very concerning. Arnieta Giraffe was born here at Brookfield Zoo. She's a sweet 16-year-old. She was a mother a while back. She gave birth to a male calf named Dave. And since then, we have been working on helping her to sustain another pregnancy. We brought a new male in to breed with Arnieta. That was part of the SSP recommendation, but unfortunately she had 2 failed pregnancies. She had miscarriages in the last few years. So we began working with some reproductive specialists that are very knowledgeable about hooved animals and animals in general. We began consulting with Dr. Copper Aiken-Palmer and Dr. Monica Stoops to figure out what was going on with Arnieta with urine tests and fecal exams to find out if she was cycling normally. And then we began a program to help support the pregnancy.
I'm Copper Aiken-Palmer. I'm one of the veterinarians here at Brookfield Zoo. I work, interestingly, with the animals clinically, but also from a reproductive perspective, because I'm also a reproductive physiologist. We need more giraffes, period, on this planet. Like, there are not enough. Over the recent years, we really realized that the populations of giraffe in the wild are in trouble. For the giraffe population under human care at zoos like Brookfield, we want to make sure that we have a healthy population. And a healthy population means a good distribution of different ages, a good distribution of boys versus females, a good distribution also of individuals that are not related. Arnieta is an interesting giraffe. She had an offspring years and years ago, but then she had 2 miscarriages. So we really wanted to know kind of why she was having those, because if she's had an offspring before, that means that she should be able to have it now. Because we didn't have a lot of information about why it was occurring, we wanted to come up with our best guesses. And so we started looking and having conversations with others that care for giraffe and others in the giraffe field, especially people who are reproductive physiologists for giraffe specifically. Henry Doorly Zoo is the obvious group to have these discussions with, because they run all of the fecal hormone profiles or urinary hormone profiles in animals that we're monitoring pregnancy for, or animals that we're trying to understand why they may not be getting pregnant. And so we kind of started narrowing down likely reasons for the miscarriages based on the information that we had and the few tests we could do. So as a giraffe, it's really difficult to perform kind of normal diagnostic tests. Like, we can't image or look at her reproductive tract without anesthetizing her. Anesthetizing giraffes comes with a lot of risks because they're so big. And so we wanted to reserve that for if we couldn't come up with any other potential cause. So after lots of conversation, we thought that the most likely causes that we could think of were probably either an insufficiency of progesterone hormone or potentially an ascending infection. Infections can move from the urinary area, the perineal area, up to through the reproductive tract and affect pregnancies. Those were the theories that we came up with.
I'm Monica Stoops. I'm Director of Reproductive Sciences here at Omaha's Henry Dorley Zoo and Aquarium. Omaha became involved in monitoring urine hormones for the giraffe. And in this particular case, the veterinary staff had reached out about monitoring to see if she was cycling, just given some of her past history. So samples were collected by the care staff, and then they were shipped here to be analyzed in our endocrine service lab. And so with that, we were monitoring urinary progesterone levels, and we were able to confirm that she was starting to cycle again. And so she was cycling at a 16-day interval, which is normal for giraffe. And so that was important information then for the care staff at Brookfield Zoo to be able to know then to start introductions of her with the male. And so we were able to continue monitoring then the female to make sure that she was exhibiting regular cycles. And then following her May 2022 breeding is when then we were able to detect by the urines that her progesterone levels continued to rise, which was indicative of her having conceived and being in early pregnancy at that point.
We went ahead and started the therapies, being the antibiotics that we did kind of on a pulsatile occurrence over the entire gestation, and then went ahead and started the progesterone. So with the hormone insufficiency for Arnieta, our theory was that at a certain point, the hormones that control pregnancy kind of shift from control by the giraffe or by the mother, by the ovary, and to the placenta. And we timed when we started giving the progesterone to when we thought that shift was likely occurring to help maintain the pregnancy. So the idea being that when that shift naturally occurs, maybe for whatever reason with the previous pregnancies, the shift resulted in insufficiency of the progesterone. The placenta maybe was not making enough of the progesterone. And so we supported her through that with oral progesterone therapies.
Any birth here at Brookfield Zoo is a big event, and it requires a lot of coordination of care for the animals. So our staff has been very busy behind the scenes monitoring her blood work and continuing to submit urine samples from her. We work with our nutrition staff to make sure she's getting a good diet, making sure that she got all of the required calories and diet changes that are necessary for a pregnant animal. Another thing that we watch for is fetal movement, and just like with a woman, you can see fetal movement across their belly. Some of the other preparations that we made for Arnieta's birth is that we isolated her from the giraffe herd. In the wild, a mother giraffe would go away from the herd and somewhat isolate herself to give birth kind of in an area where she feels comfortable. So we try to replicate that here at Brookfield Zoo. We provided Arnieta with a stall off of the main habitat away from the other giraffes, and then she spent the nights getting used to being by herself. She could see and visit with the other giraffes over the wall, but it was more of a private space for her. We added about 4 inches of clean sand to the stall to soften the floor of the stall and to make sure that when the calf was born that it had really good footing. Well, following successful treatments, we're happy to say that Arnieta gave birth on Saturday, August 19th in the very early hours of the morning at 3:51 a.m. We did a neonatal wellness exam on the calf, and we were able to get a body weight on her, and she's 128 pounds, and that's in a really good birth range. And she's a little bit over 5 feet tall. She's very sturdy. She has all normal development. Our veterinary care staff did a complete exam on her and felt that everything looked very, very good for her. After the birth, Arnieta and the calf were kept in a behind-the-scenes area to allow them to be separated from the herd so that she could establish a good maternal bonding with her mother and establish a good nursing pattern. So now that their bond has been well established, zoo guests will be able to see Arnieta and the calf either in the indoor habitat at Habitat Africa or outdoors in the habitat with the herd. We're also excited to share that the giraffe calf has a name. Her name is Kenda, and Kenda is an African Swahili word for young and beautiful, which is totally appropriate because she is a young and beautiful calf, and we're so excited to have Kenda now as part of our giraffe herd.